right, good morning. My name is Dr. Christy Lowenstein, and I'm the Interim Dean for the Hofstra Northwell School of Nursing and Physician Assistant Studies, as well as the Deputy Chief Nursing Officer at South Oaks Hospital, which is one of the two psychiatric hospitals in the Northwell Health System. Welcome to our white coat and scrub capping ceremony for our fourth cohort in the Doctor of Nursing Practice dual adult gerontology acute care nurse practitioner and certified registered nurse anesthetist program. The tradition of the white coat ceremony following the completion of the nursing student's first academic year begins today. The white coat ceremony is a symbolic and significant moment in a student's academic career. This ceremony initiates the transition to the role of the nurse practitioner prior to the beginning of the advanced clinical courses. The white coat ceremony creates a psychological, intellectual, and ethical contract between the nurse practitioner student and the profession and promotes empathy as the students make their role transition to the clinical component of the doctoral program. We thank the American Association of Colleges of Nursing and the Arnold P. Gold Foundation for their vision, leadership, and their support of this most important tradition. Scrub capping is also symbolic, and scrub caps have an interesting history. Scrub caps have graduated from being functional to also being a personalized accessory both in the operating room and outside. Before the antiseptic focus of the 1940s, hats were not considered essential to surgery. From the 1940s through the 1950s, as a hygienic focus swept the industry, hats became standard wear to help protect patients from contaminants in hair. Full face hats weren't even designed for men with beards. In the medical fashion revolution of the 70s, more and more medical professionals began personalizing their scrubs by either sewing their own hats or buying pre-made hats made of eclectic fabric. Several styles were popular, including the bouffant surgical cap, a utilitarian hairnet-like hat, which typically comes in light blue, and the milkmaid, a bonnet-like wraparound hat. Our capping ceremony is a rite of passage to symbolize where you came from and to declare with you your readiness and passage into the clinical arena to care for humanity and practice nurse anesthesia in a professional manner. Every time you don your cap, remember the faculty, the staff, your preceptors, and your colleagues at the School of Nursing and Northwell Health that have been part of your journey and your professional development. The cap shall remind you of your commitment to the Hofstra Northwell School of Nursing's values. And I would now like to introduce your CRNA Program Director, Dr. Sabrina Petrillo. Sabrina is a practicing nurse anesthetist at Northwell Health in New York City. Throughout her years as a CRNA, she provided lectures on pain management to staff nurses and advanced care providers, organized a perioperative skills day to educate staff about pertinent aspects of anesthesia, provided PACU nurses with a preparatory course to attain their certification, and implemented an outpatient orthopedic errors protocol. These opportunities earned her the CRNA of the Year Award in 2017 and Clinical Nursing Excellence Award in 2019 at New York Presbyterian Lower Manhattan Hospital. Sabrina received her Doctor of Nursing Practice from Quinnipiac University, her Master of Science in Nursing, Nurse Anesthesia from Columbia University, where she received the Ann Penland Award, and her BSN training at Dominican College. She started teaching nurse anesthesia students at Columbia University in 2018, which led her to be the Assistant Program Director here at Hofstra. Today, she is currently the Program Director of the Adult Geriatric Acute Care Nurse Practitioner, CRNA, DNP, it's a mouthful, program at Hofstra University. During this time, she graduated from the Adult Gerontology Acute Care Nurse Practitioner program and became a board-certified nurse practitioner. Sabrina is also on the board of directors for NISANA, continuing to promote and improve the CRNA profession in New York State. Dr. Petrillo?
Good morning, esteemed faculty, family, friends, and most importantly, our students. Today is a milestone, one that marks a shift not only in your academic journey, but in your professional identity. As you receive your white coat and scrub cap, you are stepping out of the classroom and into the clinical world, where your training will take on new meaning, new urgency, and new purpose. You're about to begin your rotations as future AGACMP registered nurse resident registered nurse anesthetists, a dual path that is ambitious as it is meaningful. Few choose this route, and even fewer do so with courage, commitment, and character you've shown. You are truly part of something remarkable, the next generation of advanced practice providers trained in one of the most innovative models of care in the country. As you begin the next phase, you will face new challenges, complex patients, long hours, high expectations. You will be stretched, humbled, and transformed, but you will also be supported by your faculty, your preceptors, your peers, and the values that brought you here in the first place. To the families and friends here today, thank you. Your support has been foundational. The time, patience, and love you've poured into these students have helped them bring them to this moment. Today is your milestone too. To our students, wear your white coat and scrub cap with pride, humility, and responsibility. Never forget the privilege it is to be invited into a patient's most vulnerable moments. And let your knowledge guide you, let your empathy ground you, and let your resilience carry you through. We believe in you, and we are honored to walk beside you as you take this next bold step. Congratulations, and welcome to the clinical phase of your journey. I'd like to ask the students to come up to the stage when your name is called. Okay. Majid Abu. Natalie Argudo. Sandra Baccaro. Tara Burke. Marie Chin. Aaron Chu. Andrew Coelho. Conrad Chikansky. Kyle Dillon. Lucas do Nascimento. Kathleen Fitzpatrick. Timothy Hammond. Rachel Hirsch. Jacqueline Kellner. Emma Knox. Michael LaRocco. Kimberly Yanto. Rajeshwar Lukdat. Megan McCune. Dakota O'Neill. Christina Ortiz Carey. Carrie Hughes. Michael Pugliafico. Brittany Robert. Jonathan Rothschild. Sabrina Sloan. Samuel Thomas Stubblebine. Spiros Tuntas. Mark Trocchio. Timothy Verhey. William Voigt. And last but certainly not least, Emil Zechariah.
You all look great in those coats and caps, by the way. So now your class is going to take the oath, and I would like to invite Samuel Stubblebine back to the podium to lead your class. Ask all of the nurses in the room to rise.
Could all the nurses in the room rise and say this with me? I promise to face challenges and obstacles with courage, strength, compassion, and excellence, and always remember that on the other side of my important work is a human, somebody who loves and is loved. I will remain humble, remember my strengths and the strengths of all disciplines, while embracing the values of leadership, scholarship, collaboration, and humanism. I will continue to challenge existing norms to achieve high-quality, value-based healthcare outcomes while increasing access to care. I commit to lifelong learning and providing dignity-fostering care by integrating the innovations of nursing science with the art of healing. I will foster scholarship in a culture of excellence, discovery, integration, application, and education, linking scientific discovery to advance global health. I will remain committed to the path of excellence, innovation, discovery, and inquiry, and to developing advanced practice nurses and communities of practice. I will respect diversity and have the courage to lead and positively influence future societal norms.
All right. No, don't sit down. I need you all to rise again. Turn around and face the audience. And now I present to you the class of 2027. I'm now going to ask our Vice Dean, Karina Lascalzo, to give our closing remarks.
Hi, everyone. My name is Karina Lascalzo, and I am, again, honored to serve as the Interim Vice Dean of the School of Nursing and PA Studies. As we close today's ceremony, let us reflect on what it means to wear this white coat and that really nice scrub cap. I really think it's can I say cute? But it's very nice. Not just as a symbol of clinical readiness, but as a representation of the values, integrity, and excellence that come with this noble profession. The clinical journey ahead will test your knowledge, your patience, and your strength. But more than anything, it will call on your resilience. Let your white coat and the cap remind you that you belong here, that you earn this. And I know that in just the short time that I've been here. They are here day in, day out, early in the morning with me, even at 7 a.m. And that you are capable of growing through whatever lies ahead. Support one another. This group is the only group that knows what is going on and how difficult and challenging it is. Help each other, pull each other through. Lean on your mentors, your family, your friends, your faculty, everyone around you, and trust the process. We know what we're doing, and we wouldn't have it any other way. Also, please remember to enjoy the journey. Enjoy these clinical experiences. This may be the only time that you are ever going to go through this unique experience. So take the best out of it. Enjoy it as the best as you can. Stay open to the lessons and make the most of every case you come across, every preceptor you speak with, and every challenge ahead of you. These moments will shape you into a confident, compassionate clinician. Once again, congratulations on this outrageously wonderful achievement. Go forward with confidence, purpose, and Hofstra pride, because you are the best of who we are. Students, please rise and proceed out first so we can take a beautiful photo on the front steps. Hopefully it's not raining. And if everyone could just wait until the graduates proceed out, that would be wonderful. Congratulations once again.
Do you need to go for the picture? No, not a moment.